It's one of the worst feelings at the dentist. Hearing the news that you have to get your tooth pulled out is never fun. And there's probably so many other things that's going through your mind as a dentist is telling you what's wrong with your tooth. Like, is it gonna hurt? I mean, how am I even gonna chew? There's gonna be a giant hole in my mouth. Oh, I'm gonna look so ugly. I mean, everyone's gonna see that I'm missing a tooth. It's gonna be so embarrassing. Or maybe it's not a big deal. I mean, it's just one tooth. I got plenty of other ones. I should be able to chew just fine. If you're watching this video and you wanna learn more about a bridge versus a dental implant, then chances are you probably need to get one of your teeth taken out, or you already had one of them taken out. Because I really don't know why else you'd be watching this video. Hey guys, my name is Amanpreet Singh and I'm the founder of Dental Secrets. Before I get started, if you could quickly scroll down and hit that thumbs up button, and while you're there, hit that subscribe button. I greatly appreciate it. Let's get into the video. Typically, when you're considering a dental implant versus a dental bridge, it's to replace one or two missing teeth. There's lots of reasons you would need one of your teeth taken out. One common reason is if your tooth is cracked. This is when you're at one of those frat parties and the dumbest guy in the room decides to open a bottle without a bottle opener. Hey bro, watch this. Ouch! Just kidding. But if this was you, now your tooth is broken. And this is actually the most unpredictable way of breaking your tooth because we just don't know how it's gonna break. And if your tooth already has a filling, then it's more likely to break in the first place because every time you get a filling, that tooth gets weaker. So if the crack in your tooth wasn't that big, then it could still be fixable. You just have to kind of build it up, maybe put a crown on it, or maybe even do a root canal. But if it breaks too much, then you really have no choice, and that tooth has to come out. And other reasons you would need your tooth taken out is if you have a giant cavity, or in other words, a giant hole in the tooth, and just like before, there's not much tooth structure left, and the tooth has to come out. Or your tooth could have had a root canal, but that root canal failed. The bottom line is the same. That tooth is coming out. Now before you panic, just know you have a few options when this happens. The first option I always give my patients is you can do nothing. Just because you have a missing tooth, it doesn't mean you have to do anything about it. And look, I get it. I mean, everyone has stuff going on. Sometimes a missing tooth is the least of your worries. That being said, I always give the risks of what could happen if you do choose to do nothing. If you get your tooth taken out and you do nothing to replace it, the teeth that surround that missing space will sort of drift in and try to fill that missing space. Your teeth need some love too. They don't like being lonely. So let's say one of these teeth are coming out. Now you have a missing space here, and you'll see that these two teeth will sort of drift in and close that missing space. But not only that, the tooth that's opposing that missing space will also try to drift in and close that space. So instead of looking like this, over time that tooth will look more like this. Not only does that make that missing space harder to fix, it can also throw your bite off, and it can also compromise those teeth that drifted, because those are going to be harder to clean, and instead of losing just one tooth, you could be looking at losing more teeth later on. Now the simplest way to replace a missing tooth would be with a flipper or a partial denture. This is basically a removable prosthesis, and you'll take it in and out of your mouth on your own, and it'll be used to mimic that missing tooth. This will get the job done, but it can get really annoying, because most people don't want something removable to replace one or two missing teeth. Most patients I've seen that use a flipper to replace one or two missing teeth never actually wear it, so it's really just a waste of money. Now we're on to the next two options, a bridge and an implant. Both of these options are fixed, meaning they can't be removed and they're permanent. If you're replacing just one tooth, a bridge is typically done by crowning the tooth in front of it and crowning the tooth behind it and connecting those crowns together with another crown. That crown in the middle is the crown that's going to replace your missing tooth, and all three crowns are connected as one unit. If you want something fast that's going to replace that tooth right away, a bridge is the way to go. A bridge can typically be done in 1 to 2 appointments, but a bridge does have some drawbacks. The obvious one is you have to crown 2 additional teeth. If those 2 teeth that are surrounding that missing space are healthy, then you're just removing unnecessary tooth structure. Now, not only have you weakened the tooth structure of those 2 teeth, that whole unit is relying on those 2 teeth in order to function. So if either of those 2 teeth fail, or if something happens to one of them, then the whole bridge could fail. Also, all 3 of those teeth are now going to be connected to one unit. That means that flossing and keeping that bridge clean is going to be different than you do with your normal, natural teeth. Instead of flossing up and down between your teeth like you normally do, since that bridge is all one unit, you now have to floss underneath that bridge. And this can take some getting used to, and it can definitely be annoying for some patients. The next option we have is a dental implant. An implant is basically a titanium screw that screws into your bone and mimics your root. And then a crown is either cemented or screwed on top of the implant. Right now, an implant is the best thing we have to replace a missing tooth. Not only do you get the benefits of having your own individual tooth, research shows that it has the best long-term success when compared with a bridge. So if you want something that has the most guarantee to actually work and the most guarantee to have the best long-term success, I would choose an implant. Like I said before, a bridge is definitely faster. So if you want a tooth to be replaced right now and you want it to be permanent, a bridge is the way to go. But that means you have to remove more tooth structure. It's all going to be one unit, and it doesn't have as high of a success as implants. Implants are really the best thing that we have right now, but they come with their own cons as well. Implants typically take some time before you get your teeth on them. Usually the way this would go is your dentist would take your tooth out in the first visit, and they would probably put some bone graft material in there, and that would just make sure you have enough bone for the eventual implant that you're gonna get. Then you would wait a few months and let that heal, and now would be the time to get the implant. And once you get your implant, you have to wait a few more months to let that heal, and now you can finally get that crown on top of the implant and get your tooth replacement. Sometimes implants can be done quicker, but this is the typical time frame that you should expect. Another con of implants is that people are generally scared of getting a surgery done. And the reason they're scared of surgery is because they don't want pain. Now everyone's different. Everyone has different pain tolerances, and after an implant, everyone's going to react differently in terms of how they heal. But generally, most people after getting an implant have very minimal pain afterwards. And some people don't even notice that they had an implant in the first place. And you shouldn't feel anything during that surgical process itself because you're going to be totally numb during that process. Really, the only pain you can get is from the healing that comes afterwards. What do you guys think? If you had to choose between the two, would you choose an implant or a bridge? Let me know in the comments section below. And as always, thank you guys for watching. I hope you liked the video. If you haven't already, please hit the thumbs up button and subscribe to my channel below, and I'll see you in the next video.